For our meeting today, Shaylin, I'll just kick us off if that sounds good. We have 3 different short presentations that I think will be of interest to everyone. So we're going to kick it off with Jan Hamburg from the city of Aurora. She's going to talk about youth summer programs that will probably be of interest to the youth and families that you all serve. Then we'll turn it over to Alli, and then Teresa, we've got you. Last but definitely not least. And so Jan, you've got about 15 minutes to chat with us. And I know you've prepared some slides. Do you want to share them or do you want me to share them? What's easier for you?
Rebecca, that would be great if you could share them, and then I'll just prompt you through them.
I will pull them up if you want to go for it.
Okay, perfect. All right. Good morning, everyone. So again, I just wanted to do a little presentation on all of the summer camps that we have through our Parks, Recreation, and Open Space Department. We did open up registration April 5th, and I think people are ready to get out. It's been amazing. I think parents are tired. You know, their children have been in virtual learning, and they're now ready to get out into a more enjoyable, summer activity. And so registrations have opened, and parents are signing up left and right. So it's exciting to have this opportunity with you today. So this is kind of the page you're going to see when you go on to our website, and our website is www.auroragov.org/recreation. And you'll go through, as we go through the slides, I'll show you kind of the links to go through as you're helping families navigate through our website and find what will work for their families and their children. Okay, next. Great. And so why are summer camps? For the city of Aurora, we do take pride in training our staff. They're highly trained with lots of orientation, lots of training with kids. They come in with professional classes that in our summer camps that are licensed. They have to go through 15 hours of experience before they are hired on. And we have directors as well as leaders in our theme camps. And so there's quite a bit of experience that these youth come to us with, and you'll see that in the way they are committed to the program. They're engaging, they're friendly staff, and they really just have a way of working with the children that is just, so fun. It makes them just really have a great time. We do offer, I feel, relatively, economical prices for our variety of our camps, anywhere from, you have 1-day option, 2-day option, full day options, half day options. So there really is something for every single family out there, depending on what their income ability is. A little bit later, I'll go into all the various ways to register, but the camps are really just offering a variety of diverse programs, because we don't know if the families are looking for something that is sports related, if they're looking for cooking, if they're looking for camps, or just a day here and there, or a couple of hours here and there. So once families navigate our website, they'll see the diverse offerings to choose from, and hopefully they will find something for their youth to be engaged in this summer. And then, of course, the camps are all planned out with a curriculum. The staff have to set so many hours putting together the curriculum for the camps, and that's approved by my supervisor. And along with the various themed camps, there is opportunities for the kids to go swimming, to do field trips, to do just different experiences. Okay, next. Okay, and so here, this one, it just goes through the different offerings. The first one is the youth camps. Here you'll find a combination of all the different full day camps, anywhere from around the world in 5 days. Science is sweet. The Mount Olympia, which is our Olympics camp, and then Animal Planet. And those are all right now full day options. So it's a Monday through Friday, and the children stay with us all day from 7 a.m. to 5:30 p.m. And that way the parents can continue to go to work and have their child be in a setting where they're taken care of for the day. Our Arise program is our therapeutic program, and that goes through the various activities for individuals with disabilities. They are doing various theme camps this year from 10 a.m. to 2 p.m. And again, they work with them cognitively, physically, they have different workouts, games, arts, crafts, and various different themed activities in their programs as well. Then the cooking for kids and the cooking for teens is offered. We have both half-day camps and full-day camps for those activities. And this is really fun because kids get an opportunity and teens as well, get an opportunity to engage with other people, work on recipes together. They have a flow in their learning process where they may start with an appetizer and then they end up doing the tail end of a recipe for a dessert. So it's various different components. We have children and teens work with different groups to work together on creating these masterpieces. So again, those are 7 to 10-year-olds and 10 to 14-year-olds, and most of the camps are 3 hours for the half day, a 9 to noon, and 6 hours, 9 to 3 for the full day camp. Okay, and the nature camps are out at the Morrison Nature Center and out at the Seneca Creek Nature Center at the Aurora Reservoir. And those are really some fun programs for youth that really want to learn about just outdoor survival camp, the wonders of water, different critters that are out there at the beach. And most of those camps right now are 9 to 12, and they're for 9 to 12-year-olds. So it's 9 to 12 noon, and from 9 to 12 years old for those. And then we get to our Challenger Sports Soccer Camp and our Skyhawk Sports Camp. These are a variety of different sports that youth may be interested, anywhere from, it could be volleyball, flag football, soccer, baseball, tennis, pickleball, basketball. So the assortment of those sports is endless depending on what your family is interested in. And again, those are 4 years old to 14 years old. And they're actually offered all around the metro area. Aurora is just one location in those sports. And as you navigate the website with the families, you'll see that it's all over through the metro area. And it's just really, all of these programs are really a fun way to engage the kids, give them some lifelong learning, healthy lifestyle, fitness, arts, crafts, just a different variety of all things to pique their interest. The preschool camps, which is the second to the last, pretty much is at 5 locations around the city from ages 3 to 6-year-olds. And these are focused on pretty much usually 2-hour programs to 4-hour programs to 6-hour programs. So as you navigate the 5 locations throughout the city, it just depends on what those parents are looking. If they just want their child to go to a 1-week, 2-day-a-week program, they have a choice of 2.5 hours, 2 days a week. And all the themes are anywhere from jungle themes to a passport around the world, astronaut, dinosaur, mini chefs, scientists, under the sea, pirates, princess. I mean, there's so many in preschool. I can't name them all. And then under aquatics, basically that is a full scale of swimming lessons throughout the our indoor and outdoor pools around the metro area. And then we have a few of the soccer camps available for the kids as well. Okay, next. And then here, so really what we're trying to encourage the families to do is these spaces go quick, sign up now. We're making hopefully registration easy for the families. The phone number I put out there, which you can certainly send this PowerPoint out to everybody, is our registration number, Monday through Friday, 8:30 to 4:30. I think they do take a noon break. So if you do call on the recorder and they're out for lunch, they'll tell you to call back. We do ask the parents to register online through Perfect Mind if they need help navigating our software program. Staff at that phone number will assist them in setting up their account. And then, of course, at the same number, fees are reduced for residents of Aurora on limited incomes. And so once they call that number, the staff will go through the eligibility and the application directions. Okay, and next or last, okay. So this is just, yeah, this one is just, yeah.
Sorry, I'm having some clicking issues.
No, it's okay. I'm speeding up a little bit because I know I've got a time limit. This is really all of the special events in our marketing and special events area. All of these are free activities. They're fun for the kids. They're trying a lot of different programs this year to engage the children. Again, a full list of all of these programs will be online, but I wanted you to see a snapshot. If parents are looking for free events, this is really fun. And we already began with our Blooms of Fun in April. And then the next slide, Rebecca, will be the Passport program, where what this is as families sign up and they go to various places throughout our department, they will earn points by visiting the Nature Center, by visiting our Colorado Freedom Memorial at the Beck Center, by visiting one of these special events, going to disc golf at the Expo Park, or taking a selfie and tag us on social media. So the families will earn points. And if they earn 100 points, they'll get these swag bags and these goodies that are given out by our department. So I wanted to put that in there because it's really a great way for our families that are either new to Aurora or that have never really visited a lot of places in our fabulous city. This is where they can go to earn those points to get a grant. And then of course you go into a drawing for a grand prize. Okay, next. And really last of all is really just, thank you for your time and letting me kind of present a quick snapshot of our programs. We've gone really from a brochure style guide, which is what we used to do, to really forcing families to go online to look at our program. So whether the children and families are looking at a sports camp, swimming lesson, just drop in swimming, fun and games at our youth camps, a cooking camp for youth and kids, whatever the interest is of the children. We really offer a very safe environment. We follow all the Tri-County CDHS rules and guidelines, and that will not stop just because we're opening up our capacity. We do have to follow all those guidelines and protocols to make our staff and our families safe. So that's really all I have. Is there any questions I can answer for any of you?
I have a question. This is Teresa with ACC. Do you do any special like accommodations for special needs children or youth?
We do. So our therapist, so Arise, the program Arise stands for, so what it is, it's adaptable and inclusion programs for everyone. And that program does, when we have individuals with disabilities come into our various programs, whether it's sports, preschool, camps, we recruit our therapeutic recreation staff that all have degrees. It's called CTRS. So they have a special degree and certification to help us navigate the intake process and work with the families on how do we include those children into our program. Sometimes it does need more staff, and that would be up to the parents to maybe help us out with them volunteering too. And sometimes the children can mainstream right into our activity, and it works out really fabulously. So yes, we do work with inclusion with all individuals with disabilities, and we try to accommodate their needs to the best of our ability.
Jan, that's a lot of great information, and you went through it just precisiously. So thank you. Very, very nicely done.
Well, great. I'm watching my time, and I know there's so much. PROS is such a huge department, and I want to try to include all of it because it's really not just recreation. That's just one snapshot. I mean, we have beautiful parks out there. You have open space, you have nature centers, you have the reservoir. And so it's really nice to let families know that there's really endless opportunities out there for you. And it doesn't really even have to be fee-based programs. So I wanted to make sure I gave that to everybody so that they have those options as they look into our programs.
Well, I feel like we hit the gold mine having you kick us off this morning, since so many of our members this morning were really looking forward to getting outside and activities and recreation. So it was a perfect introduction to start off our meeting this morning. I just want to remind the group that all three presenters put together some slides, and we'll be sure that we send out the slide decks to you after the meeting. So you'll have this information so you can click on the links and use the links that have been provided. And then it's always good to process. And if you need to follow up later, you'll have that information. So we will be sure to send all three decks to you. Jan, thanks again for your time this morning.
Thank you.
Shall we move forward with Alli? I believe you're up next.
Awesome. Okay, I'm going to try to share my screen. I
Great.
think I know how to do it. Let's see how it goes. Do you see slides? Okay, it worked. Can you also see my notes? Because I'm not supposed to be showing those. Okay, woohoo! Success. I'm still getting used to this Zoom life. Awesome. Well, yeah, so I was asked today to talk about legislation and policy that impacts kids and families. And there are tons of bills that impact kids and families. And this is just a really small amount of them. When I'm done presenting, I'm going to put a link to the legislative website in the chat too. So if there's any bills that you want to follow up on or find out who the sponsors are and contact those sponsors to advocate for the bill, I want you to be able to do that too. So after I finish up, I'll make sure that that's in there. But yeah, there's lots of bills. I only chose a few, and I'm starting off with behavioral health because I'm biased. because I love behavioral health and kids. So there's a couple key behavioral health bills this year. I know one of these you've already heard about in a lot of detail, House Bill 1097, that establishes the Behavioral Health Administration. And so since you've heard so much about it, I'm not going to go too much into it, but the kind of big picture is that it sets timelines for the state to create a single state agency that will lead, promote, and administer all of the state's behavioral health policies. And our biggest priority in working on this bill has just been making sure that Medicaid programs are also meaningfully integrated into it so that all kids are served and are able to have accountability in their behavioral health. This bill was signed into law on April 22nd. By the governor. So it's moving forward and it's all done. Most of the other bills that I'm going to talk about are still in the process. So some of them are going to be, they still need funding. So not all of these programs will be potentially passing. So that's one of the reasons too, if you have questions about any of these, you can follow up with me offline, or you can look at the legislative website for more info. So an example of that, House Bill 1068. This bill requires health insurance companies to cover a mental health wellness examination of up to 60 minutes as a part of their mandatory health insurance coverage within sort of the preventative healthcare benefit. The coverage of the exam is required to be as extensive as it would be for like a physical wellness exam. This bill is actually just getting its first hearing tomorrow. So there will be some changes to it. In the past, the governor has not been super supportive of healthcare mandates and health insurance mandates. So I don't entirely know if this bill will be moving forward kind of and passing and getting signed by the governor. So it's still so early in the process, I really don't know, but it is definitely an interesting one to keep your eye on. Related to that is House Bill 1258. This is a bill that's coming kind of out of the governor's office that creates a temporary youth mental health services within the Office of Behavioral Health that allows kids to voluntarily self-screen, like on an app or on a website, to screen themselves for mental health needs. And then the app at the end, once you kind of finish out your survey results, connects you with providers for up to 3 telehealth mental health sessions. I think some of them can be in person as well, but the main emphasis is telehealth. And the goal is to get as many kids as possible screened before returning back to school in the fall. And the state is actually going to be putting this, is going to be implementing this program really quickly. So the bill has already passed the House. It's under consideration in the Senate and will be on the way to the governor's office soon. And so that way they can get it up and running, because they would like kids to be able to have access to it before this school year ends. And they also want to be able to utilize schools as a way to make kids aware that this tool exists. So kind of within your networks as this bill is moving forward, I know the sponsors would be very appreciative of kind of the grassroots efforts of sharing that this tool is available for kids to use. There is also a marketing budget too, so that's positive. There's also House Bill 1106. This bill requires gun owners to safely store firearms to prevent access by unsupervised by unsupervised youths and other unauthorized users. It creates a crime of unlawful storage of a firearm if a person is storing a firearm in a way that they know or should know that a youth could gain access to the firearm. And it would be a Class 2 misdemeanor. It also requires gun dealers to sell and transfer firearms with locking devices to secure them. This also became law on April 19th. And you probably noticed also in the news, there's a whole slew of firearm related legislation that's been introduced that I'm not going to go into today, but you'll definitely see a lot of news coverage in the coming weeks as the legislature continues to work on other firearm regulations. And then for the final kind of behavioral health bill, like I said, there's a bunch I could have talked about, but I chose a few. Senate Bill 154. This implements a federal law that requires 988 to be used as the suicide prevention lifeline. And so this bill will implement 988 as Colorado's crisis response services line. So right now there's I think it's a 1-800, or I don't know if that's exactly the front, but number for crisis services. That line will probably also stay active for a while, but at some point I think it will probably transition to be 988. Right now there's a big stakeholder group going through the process to figure out really what is going to happen with those two numbers. But the idea is that this bill requires the Department of Human Services to contract to start working on this 988 work so that users will be able to call 988. The federal deadline is by June of, I think the end of June of 2022. So by next summer, people should be able to use one simple phone line in order to access crisis services, which I think is great. There's some really good early childhood legislation also. Childcare is a really big issue for the legislature every year. Senate Bill 236 creates 4 grant programs to expand capacity of early childhood. One of them is an employer-based childcare facility grant that gives entities the ability you give them grants to construct, remodel, or retrofit a childcare center near basically near places like near workplaces. And the kind of big concept of this is the idea of retrofitting downtown spaces that aren't needed anymore because we have such a remote workforce because of COVID. And a lot of companies have signaled that they're not going to go back to offices. So to allow some of those sites to be turned into childcare. There's also an early care and education recruitment and retention grant program that gives providers the ability to give their workers things like raises, bonuses, trainings, professional development courses in order to recruit and retain more workers. There's a childcare teacher salary grant program, which increases salaries of educators, which is a really big issue for retention. And then finally, there's a community innovation and resilience for care and learning equity, or CIRCLE grant program. And that addresses systemic challenges like increasing affordability and access to childcare through things like tuition subsidies and scholarships. It also works on some employer-based cost sharing. And so the kind of whole motivation behind this bill really as a whole is to fund ways to increase retention of early childhood workers. And it has passed through its first committee, but it's awaiting appropriations, which means it's awaiting to be funded by the legislature. House Bill 1222, this bill changes the classification of a family child care home to be considered a residence for the purpose of licensure and local regulations. This makes it so that these homes can operate as child care centers without having to buy things like a full fire sprinkler system that costs $50,000 for a home, because so many kids are served in family child care homes, but because of local zoning and land use regulations, sometimes the cost is really prohibitive. So the idea is to expand access to childcare by lowering those regulations. This has passed both the House and the Senate and is awaiting the governor's signature. Every indication is that he would sign it, so no concerns about that. And then finally, Senate Bill 27. This bill requires the Department of Public Health and Environment to work with nonprofits to administer diaper distribution. And these diaper distribution centers would provide diapering essentials to Coloradans. During the pandemic, there's been a 300% increase of diapering essential, like families who need diapering essentials. And 35% of Coloradans reported finding it difficult to pay for these necessities like diapers and wipes and diaper creams. This also increases access to childcare because a lot of families you have to provide diapers to your childcare facility. So if you can't afford those types of things, then families aren't able to send their kids to childcare. This is also awaiting an appropriation of about $4 million. I bring this up because I think some of these programs are really awesome, but the whole legislature only gets about $40 million to fund everything that they want to fund outside of the normal budget and outside of like everything that's done. They're only giving this sort of like $40 million of flexibility. And so some of these programs are not going to make the cut. So if they're important to you, I would definitely do some advocacy on that as well. There are some, I'll kind of run through these a little bit faster, but there are some really important maternal and reproductive health bills that are coming through as well. Senate Bill 193 has to deal with ensuring access to perinatal health and healthy foods and parenting support for individuals who are incarcerated. It also requires labor and birthing facilities to have policies that allow every birthing person to have a companion there during birth, in addition to a partner and a spouse. So potentially somebody like a doula or whatever the spouse is wanting. Senate Bill 194, this bill requires the Department of Healthcare Policy and Financing to amend the Medicaid state plan to provide 12 months of postpartum medical benefits to individuals who qualify for Medicaid during pregnancy. Right now, that coverage only lasts 2 months. So it's a really big expansion and a really important one because we know health needs go beyond just 2 months postpartum. And this one also has a large fiscal note and also needs some advocacy behind it. So if you think this is important, I definitely encourage reaching out to your legislators. Senate Bill 25 is a bill that expands Medicaid coverage for family planning services to people up to 260% of the federal poverty level, which is higher than the current requirements are. Colorado would be just one of 28 states that do this. So there's been a decent amount of movement to expand Medicaid in this way. It's estimated that 20,000 women in Colorado would gain coverage under this. So a really huge impact. This one's also awaiting money. This is a theme. Everything needs a little bit of money. And then the last one, Senate Bill 9, is it also requires the Department of Healthcare Policy and Financing to administer a reproductive healthcare program that provides contraceptives regardless of gender, citizenship, or immigration status. So this is another important Medicaid expansion. We know that undocumented immigrants in particular find barriers to accessing contraceptives, and Latina youth experience pregnancy at roughly twice the rate of their white counterparts. So this is a really important health equity issue as well. Okay, and then the last two that I'll try to make quick too. There are a couple bills just about social determinants of health. These are they're always like one step removed, but we all know that social determinants of health are such a huge driver. House Bill 1105. This requires utilities to collect a monthly energy assistant benefit charge from every customer starting this October that will help finance the low income energy assistant programs that are administered by the state. This creates sort of a more consistent funding for those programs. And we know that especially during COVID, there's been a huge increase in the amount of people who need these resources. The bill also creates a water assistance program that would help people pay their water bills. However, this is funded through optional contributions on your water bill, as opposed to the other program is mandatory. And then House Bill 1121, this is to do with residential tenancy procedures. This bill's changed a lot. It's a kind of a moving target, but some big pieces are still in it. Under existing law, if a landlord wins an eviction action, the court waits 48 hours to issue an order that then directs the sheriff to assist the landlord in removing a tenant. This bill changes that to 10 days from 2 to 10. The bill also prohibits landlords from increasing rent more than one time in a year. And it also requires written notice of an increase if the rent is being increased. It requires the notice to be 60 days long if the lease doesn't have a written agreement about that. And so this is another one that we know that impacts families and kids in a huge way. It's passed the House and is just awaiting passage in the Senate. So like I said, there's just so many bills I could have talked about. But I think these are kind of some really important key ones, I suppose, but there's a ton that I could have talked about. And thank you for those fast links to those bills. You are killing
Welcome. It was fun.
I know, Mandy was all over it.
I love this.
Very
And also, correct, Rebecca, the Colorado Children's Campaign did a really great podcast about the diaper bill. I really enjoyed that episode and felt it was really helpful. They have some good podcasts in general. And Jay Brainerd, was it Jan? I'm trying to remember.
It's Jan, sorry.
No problem.
I was wondering if you were taking questions.
Yeah, we have a minute.
Okay, real quick. I noticed around SB 2194 that was on your second to last slide, I believe. Are there any of those bills including any funding around postpartum mental health and any of those maternal or pregnancy, if you will, prenatal and postnatal?
Yeah, there is some. I don't know the details of these bills too closely. There's also the Behavioral Health Recovery Act, which is Senate Bill 137. That includes funding in it also for maternal, fetal, and like behavioral health components as well. I'm not entirely sure because I don't track this bill super closely. But yeah, there is some funding for that.
Oh, good. Thank you.
Yeah.
Any other questions for Alli in the moment? Well, Alli, thank you for all of the information, the list of important things for us to be following, keeping track of. Again, we'll be sure to include the slides for those that want to dig a little deeper. and your contact information as well for anyone that wants to reach out. So thanks again for your time. All right. As Rebecca stated earlier, moving on to our last presenter, but definitely not least, we will turn it over. Do I see her? Where'd she go? There she is. I lost you, Teresa. Sorry about that.
No, it's okay. I can go ahead. I can share my screen.
Sounds good. Thank you.
Mhm. Is that good? Okay, great. Well, I'm Teresa with Aurora Community Connection Family Resource Center. And so ACC, we're located northeast of Aurora. So our mission is to develop the capacities of underserved families, increase resources, and promote social equity. And our vision is to foster healthy interdependent communities by recognizing and engaging people's capacities. We've been around since 2008 and to address a gap in services for low-income Spanish-speaking immigrant families in North Aurora. But throughout time, we serve anyone and everyone, not specific to Aurora. So we do have a lot of people from Denver as well. But our aim is to increase access to health and education for local families. We are a very small agency. We have currently 11 full-time staff, but we do have over 20 contractors and volunteers. We do have a diverse board of directors who Rich McLean, he's one of our members of a board of directors, and also a community advisory board that work together alongside with our board of directors. We are open Monday through Friday, 9 to 5:45. We're right across the street from the Martin Luther King Library on Colfax and Dayton. And then here's our information and a little map. And I will put this in the chat too, just our phone number. But ACC, so we do focus on health and education. So I'm going to go over just the different programs that we have. Our programs run usually it's the spring, summer, and the fall, but we do have some services that are year round. One of those is health access. We do have 2 full-time staff members who focus just on helping apply for Medicaid Connect for Health year round. There's only open enrollment that runs from December or November through January, but we do that year round for those that qualify. Medicaid, CHP, we do redeterminations. If anyone just has any questions about their eligibility, they can always give us a call and we can check on that too. It's a little easier than going through the offices at the county sometimes. We also help with the SNAP applications, and currently we're getting ready to do the pandemic EBT for the summer. So if you do have any families, we can do in person or online or video Zoom appointments with our families. We do offer general advocacy resource and referrals. So we have a few staff people who just dedicate full time to helping individuals their access to resources. So it could be food banks, clothing banks, legal services. As part of this, we have what we call family support services. So it's staff who work alongside with a family or an individual providing comprehensive and coordinated case management. So if we have a family who they need to renew like their driver's license and they don't know where to go, or we can help just kind of guiding them until they complete that goal and renewing an ID or a driver's license, but just different goals. We have wellness programs. So recently we hired a bilingual health or mental health therapist who provides both one-on-one and group sessions. We have the nurturing parenting program. We have a yoga class. Currently it's for women. We have adult support groups, parent support groups. We are big on mental health with kids as well. So we do provide a lot of programs. So we have, like, for instance, this cooking class or exercise classes, but we do always have a concept of just providing a little bit of mental health with that. We have exercise classes for both adult and for children. This has shifted a little bit because of the pandemic, but now because the weather is nice outside, we'll be able to provide these outside. So we have Zumba, yoga, Mexican folk dance, martial arts. We have Catch, which is It's a program, it runs from preschoolers through elementary and some middle schoolers, where we just do play with jump ropes, hula hoops, catch, and just different sports for the little ones. This summer, we're also going to have soccer and basketball. Our focus is also on education, so we provide a lot of programs around education. Our biggest one is our tutoring program, which currently it's for elementary and for middle schoolers, but kids will come in after school for 2 days a week, and they will work one-on-one with the tutoring. The focus is mainly reading, but we do also math or other subjects in school. And we have opportunities for youth to be volunteers and with college support. And we have PAT, which is Parents as Teachers. We have 2 full-time staff who provide PAT, which is working with pregnant mothers or with kids through the age of 5 and doing home visits. We're going to start doing the home visits because of the pandemic. We haven't been able to do home visits, but we have had some families come into the ACC, and we do provide those visits that way, or some of them have been through Zoom. But it's just in doing activities with the parents and helping with the development of their 0 to 5-year-olds. We have the Latino Family Literacy Project, which we're going to start again in the summer, and it's a structured family literacy program that guides the parents of children over the age of 2 in support of how to support literacy at home. It's a pretty neat program. And then we have our citizenship classes, which is on Saturdays, and we have a new program which is called Lee Conmigo Preescolar. So it's with kids between the ages of 3 and 5. So when the older kids come to our tutoring program, we usually have a lot of like the younger siblings, the 3 to 5-year-olds, but we've created a program where one of our staff, they'll take the little ones and they'll start like socializing with them and reading them books, just to kind of help them prepare for preschool. We are currently providing emergency assistance. So it's through the Left Behind Workers Fund for both cash and rent assistance. And so if anyone that has been affected by the pandemic who has decreased their hours of work or has lost employment, you can have them give us a call and we can screen them to see if they would qualify for the emergency assistance. We have a lot of volunteer opportunities for all of our programs. And here is Parents, Kids, and Teens in Motion at ACC. So we're going to have our summer program, which will start, it's going to be for 8 weeks for the months of June and July, Monday through Friday. So we're going to start with sports in the morning, soccer, basketball. We have Girls on the Run also, which is a running program for middle school girls. And then we have like a snack or a breakfast, and then we have a wellness groups. So it's art, science, a friendship group, and these are created by 2 social workers and staff. So it has that concept of that social emotional. And then we have our tutoring program, and then more exercise in the afternoon. And we do provide lunch, a hot lunch through the Food Bank of the Rockies. And all of our programs have a very low cost for 8 weeks. It's it's $20 for the 8 weeks per child. So it's very low. We do have, we're signing up to 25 kids per session, just because we are taking all of the precautions and following all of the guidelines that we need to. It's $10, say if the child is only interested in soccer in the mornings and they're not interested in any other programs. If they just sign up for one program, it's only $10, but that covers all 8 weeks. And then we have, again, the programs for our adults. And then something that we're going to start doing is on Fridays, we do have field trips. So we go to visit museums or different parks in Aurora. And then just, we are having a health fair just to help with vaccines and free health screenings for our community. And that's going to be here in our building at the ACC. Our first one is going to be this coming Saturday. So we're encouraging people if they can register for the vaccine, but if not, they can just go ahead and walk in. We're doing a lot of promotion for the vaccine. We've found a lot of our community does not want to participate in the vaccine. Currently, we have 200 slots open, and in a week, we've only had 15 people register. But we have our community advisory board. They're working daily to promote in schools. There were churches. Rich is also helping us out in churches to just get the word out and the importance of being vaccinated. But we have that concept of the free health screenings as well, just to see if we can get more of our community out here on Saturday. And then our next health fair is going to be on June 5th, and they're both from 10 to 2 p.m. So I'd really appreciate if you can help us get the word out for these 2 events. And that's ACC. And if anyone has any questions.
I have a question. Teresa, thank you so much for that. Do you have, is there information about the vaccine event on your website that we can share, or is there anything on social media that we at the Alliance and other organizations can share?
Yeah, we do have it on like on our Facebook website. We've posted it on social media, but I will go ahead and I'll email it to Rebecca, our flyer, so she can get it to everyone. Thank you.
Awesome, thanks.
Teresa, for your vaccine event, are you looking for any type of vendors or anything like that?
They're more than welcome. Yes, currently we have the Dawn Clinic who will be coming in, and the ACAN, the Aurora Coverage Assistance Network, they'll be coming in. But if anyone else is there, you're welcome to.
Okay, cool. Thank you.
Great. Well, if there's no other questions for Teresa, thanks so much for sharing that information. I always learn something new about and all the great stuff you guys do. A couple people had to leave us for another meeting, but we do have some time for community announcements. So if there are other folks on the call who were not presenters today, but would like to share something, this is the time. Or if you've thought of additional questions for our presenters, you're welcome to share them now. Who has something they would like to share with this group?
I'll put something in the chat. We are getting, this is Damien again with Pasco. We started something a couple of years ago with just like with a lot of agencies working with kids, kind of like a happy hour, kind of a networking thing. We're going to have one on Thursday at Brewability Lab in Englewood. If you're not familiar with Brewability, it's really cool. They hire people with intellectual developmental disabilities, and they have pizza there and they brew beer, and it's a nice place. So I'll put that in the chat. I know it's super last minute, but we're going to try to do these like monthly, and that'll probably be the place to go. But it's a great way to kind of meet people more in the disability space. But I think we're always willing to meet other people because I think we're all interconnected in that holistic approach to kind of working with our families and our kids. So I'll put that in the chat right now.
Question: is there a way to get on your list for those events? Does that get blasted out somehow? Because I'd be interested in going. Oh, you're on mute.
Now I'm on mute.
You jinxed yourself
yes.
for the whole day.
Yeah. Yeah, I think if I can get the emails from people on this call, I can get that on. I mean, it's kind of, I don't have like a chimp mail or whatever that's called, MailChimp, but I'll do something. I put it
I'll
together
send you my
every time
email
I
right
have to
now.
reinvent the wheel. Thank you, people. And I'll add some of the people from DP that are doing that trivia thing, and we'll get you guys on there too.
Perfect. Thank you.
All right. From Tri-County Health Department, we are now doing walk-in appointments for vaccine at 3 of our clinics. One in Aurora at Colfax and Chambers, the other one at our Westminster office, and I cannot remember the third one off the top of my head at this moment. I can look. So all the information is on our website, tchd.org, but if you know folks who are looking for vaccine, that's one place that they can get it of many right now. Thanks, Mandy. All right, well, if there's nothing else, we can wrap up. Everyone should go like put their face in the sun for a few minutes. That's what I'm gonna do. So have a good rest of your day. Thanks so much for being here. Our next meeting is scheduled for August. I think that's gonna be a joint meeting with the behavioral health group from Aurora Health Alliance. So you can look out for more information about that. It might be for our meeting time, it might be during their meeting time. We're working out the details. Thanks so much to all of our presenters for all the great information. Yes, Bonnie said great information. Thank you. Totally agree. And Mandy for managing our chat today. I hope everyone has a good rest of their day and we'll see you soon.